What if I told you I could give you a pill that would make you live 10 years longer, healthier, sharper, free of disease? How many of you would take it? There we go. Of course you would. The allure of a pill is irresistible. But what if I said that we only know that it works in mice? Side effects? Unknown. And these long-term outcomes? It's just a hypothesis right now. Some of you might be thinking, maybe I'd rather just eat some more vegetables. After all, how can we truly prove any longevity intervention works without waiting decades to see if life is actually extended? And humans have always searched for more time. Did you know that Qin Shi Huang, the first emperor of China, drank elixirs of arsenic and mercury seeking immortality, only to die of poisoning? Or that in the 1900s, radiation was used as a beauty aid for acne, until we found out it caused cancer. Ironically, we can use either arsenic or radiation to treat cancer now. Medicine or poison, it all depends on the dose, the context, and the person. That nuance, that complexity that actually defines the practice of medicine, is missing from much of what you see online about longevity. Just go on social media. For a mere $99 a month, you too can enter the candy shop and buy the illusion of some one-size-fits-all longevity protocol. But for every promise sold, there's a real human being just trying to make sense of their health. Let me tell you about Anne. She's 46. She has 2 children at home. She's grinding under daily stress, and she wakes up in the morning exhausted, nauseated in her stomach like she's rocking on a boat. And she's worried because her father died of a heart attack at 52, and she's terrified. Could she be next? One evening, after another round of pounding heart palpitations, she gets herself to the urgent care just to be told, "You're fine. It's just stress." That night, she can't sleep. She's Googling WebMD, she's scrolling biomarkers and biohackers, she's just trying to make sense of everything. It takes her months to finally get in to see her primary care doctor, and it's a rushed 15-minute visit. She's pushing for help, but the doctor's in the screen, "Your cholesterol is fine." And it's not that doctors don't care, it's that time and complexity get in the way of care. Did you know that the average primary care doctor has a patient panel of about 2,000 patients that they're responsible for? And a recent study showed that if a doctor took care of such a panel, it would take them 26.7 hours per day. That's per day, just to check off all the boxes, taking care of the basics for them. It's not a sustainable solution. Imagine you're asked to do 3 days worth of work every single day. I know, I've been in this system before. And I remember one Friday evening after a long day of back-to-back shifts, at the end of a long week, I'm getting ready to go home when all of a sudden, bing, I get a message in Patient Gateway. "Dr. J, I'm having shortness of breath again." And this was a sick patient. He'd been trying to get into my schedule for weeks, but my schedule's backed up for months. And I'm thinking, this has to happen on a Friday night. But I remembered what my mother, also a physician, told me when I first started medical school. If you treat each patient like it's one of your family members, you'll always do the right thing. So I call him up, and I try to figure what's going on. Indeed, he is sick. He does not want to go to the ER. I'm not certain he needs to go to the ER, but he certainly needs medical attention. But the clinic's already shut down, so I have to get creative. I end up calling a paramedic to go to his home to get an EKG and vital signs, try to figure out how can I adjust his medications over the weekend to make sure he doesn't end up in the hospital with heart failure again. So, keeping a sick patient out of the hospital, that's longevity. That's just the practice of medicine. So that night, I had trouble sleeping. I kept thinking, how did Paul get so sick in the first place? Let's call this patient Paul. And when was he last well? And what happened in his life to change the trajectory into one of ill health? I came to the conclusion that unless we change how we deliver care, we're often showing up too late. So here's the question. What if the most pressing breakthrough in longevity is not the next pill, but a new system of delivering care. A system that is human-centered, proactive, and prevention-focused. Not longevity pop-ups and biomarkers in isolation, but longevity as inseparable from primary care, inseparable from the practice of medicine. That's where it belongs, and in fact, that's where it's always been since the time of Hippocrates. And so this is what I'm trying to envision: a new system of primary care in which longevity lives. So let's imagine Anne. She goes to her doctor's office, and they sit down face to face for the first time, and they get to work on her issues. What she doesn't know is behind the scenes, tools like AI is gathering all of her data that's in different silos and making it much easier to get the work done. The notes are being written automatically in the background. Agentic agents are fighting insurance for the prescription denials. And remember her concern about heart disease? Well, what if we could actually just map her proteome, map her genome, and compare it to biobank data and come up with a personalized risk score? That sounds cool. And better yet, what if we can actually just do a three-dimensional model of her heart blood vessels with a CT scan and find out, does she or does she not have plaques? And so we do that, and we find out she does, but it's not too late because we catch it early and we intervene. And so we finally have the time to merge care and science, individualized for the person. Remember Paul? Well, what if instead of waiting to get into a single primary care doctor's office, he had a primary longevity team? Physician, nurse practitioner, experts in fitness, nutrition, coaching, each member of the team designed to maximize their impact, and the team as a whole maximizing the number of people served. And this team can double down on what I call practical longevity, the things we can do right now that have the most impact: nutrition, exercise, sleep, and human connection. And I think if we can design this correctly, we can scale it to be accessible to more people. Right now, when billions of dollars are being poured into longevity, it's a very exciting time. We could be at the precipice of some foundationally different life experiences for the length of human life. But if we don't also design systems that can deliver these personalized treatments to the people who need them, then we're only solving half the problem. Because preventing cancers and heart disease, that's longevity. Helping someone age to 95 with strength and dignity, that too is longevity. And yes, helping our patients through these personalized advances at the forefront of science, that's all longevity. And in fact, in some ways, it's all really, really good primary care if we just figure out how to redesign it. So I'll leave with this. I still have a doctor's black bag, and in it I carry all the tools of modern medicine: genomics, diagnostics, therapeutics, wearables, whoop, AI. But I also have my stethoscope, because to me, longevity isn't just about all the new technology. It's about listening to the heart of each patient. And I believe the future of longevity will not just be decided in the laboratory. The future of longevity depends on how we decide to care. Thanks.